Welcome to the Health Bulletin. Across the globe, we've tracked the emergence of mysterious illnesses, unusual health phenomena, and groundbreaking medical discoveries. But guess what? There's so much more to explore, and we don't want you to miss a single update. This week, Amazonas issued an epidemiological alert for the Oropouche fever, a virus which is similar to dengue. Since the beginning of this year, there have been 398 confirmed cases of the disease reported. On Thursday, the city of Rio de Janeiro confirmed its first case of the infection. Besides Amazonas, the states of Acre and Rondônia are also experiencing outbreaks. The Pan-American Health Organization and the World Health Organization are calling on member countries to ramp up their monitoring efforts to quickly spot cases. They also emphasize the need for health workers to get the latest training on identifying and handling these situations effectively. According to the entity, most outbreaks occurred in all age groups and genders, but children and young people were the most affected. Before we move forward, please hit that subscribe button and join our Health Bulletin community, because subscribing not only supports the channel, but also ensures you're always in the loop with the latest health trends, news, and tips that matter to you. Plus, it's completely free. Even though the cases are mainly in Brazil's northern region, there's a nationwide worry about a potential outbreak, especially considering the current dengue epidemic. Just last Thursday, Brazil hit a worrying milestone with 1 million probable dengue cases, a disease spread by the Aedes aegypti mosquito. According to the Brazilian Society of Immunizations, there's a risk that this disease could spread across the entire country. Though such a spread wouldn't happen instantly, there is no cause for alarm. Diseases like dengue and yellow fever start in certain areas and then spread. It's the same with Oropouche fever. When more people catch it, it's more likely to spread. This is because the mosquito that carries Oropouche needs to bite someone who's already infected to pass it on. So when someone visits a place with lots of Oropouche cases like the North region, they might get it and bring it back home, increasing the risk for others. That's exactly what happened with a man in Rio de Janeiro who got Oropouche fever after a trip to Amazonas. The situation is currently being looked into by a team of health experts. Meanwhile, you might be wondering, what exactly is Oropouche fever? It's an illness brought on by an arbovirus, which means it's spread by insects. Specifically, the Culicoides parensis mosquito, often referred to locally as maruim, is responsible for transmitting it. The virus behind this disease, known as orthobunyavirus oropouchense orave, was first identified back in 1960 as per the Health Ministry's reports. It was isolated from a blood sample from a sloth captured during the construction of the Belém-Brasilia highway. The symptoms of Oropouche fever are similar to dengue and chikungunya, and therefore the diseases can be confused. This is the case with headache, joint pain, muscle pain, nausea and vomiting, and diarrhea. To differentiate Oropouche fever from other arbovirus infections, it is necessary to make a diagnosis, which is clinical, epidemiological, and laboratory confirmed. Basically, doctors check the symptoms, ask if you've been around anyone sick or in places where the disease is spreading, and run tests to rule out other illnesses that might look the same. The Ministry of Health also wants to remind everyone that Oropouche fever is on the list of diseases that must be reported. This is because fever has an epidemic potential and a high capacity for the virus to mutate, potentially becoming a threat to public health. Its treatment must include rest, hydration, and the use of medication to alleviate symptoms. Thanks for watching Your Health, Our Mission. Remember, staying informed is the first step towards a healthier life. So, what are you waiting for? Hit that like and subscribe button, and let's make health a priority together. See you in the next video.